Hey there, class. Today we're going to talk about hemoglobin, and I'm just kind of reminding everyone kind of objectives here. How we're going to talk about how oxygen binds to hemoglobin, some of the structure changes that occur, and the change in pH, and a couple other things that occur as we kind of go along. So this is the structure of hemoglobin, and it is actually this ring here that allows oxygen to bind to hemoglobin in the lungs. There's a sixth coordination spot which remains unopened, where oxygen can attach. So actually we're going to go look at another. So let's kind of blew this up here. So before oxygen, let me rephrase that, before hemoglobin becomes as we know it, it's actually referred to as deoxyhemoglobin, which, if you take it the root word deoxy, meaning without oxygen, and this is referred to as the T state. But once oxygen does bind, there is actually a conformational change that occurs where it becomes, as we're kind of more familiar with it, as oxyhemoglobin, and becomes the R state. And when this occurs, there is a change actually in the quaternary state of hemoglobin, which we can consider to be a protein. And in this, there is actually not only a change in the protein, but there is actually a rotation of some of the alpha and beta dimers when in that T to R state transition. So the next thing we're going to get into is kind of the unloading of oxygen into the tissues. And so as you move into the periphery, actually there's a couple of things that happen to oxygenate, our various tissues in our body. And one of those structures that assists with that is 2,3-biphosphoglycerate, which is an anionic compound that's present in red blood cells. And this molecule binds preferentially to deoxyhemoglobin and stabilizes it, which then reduces oxygen's affinity and leads to the release of oxygen in the tissues. When hemoglobin is going through the various tissues in our body that are not our lungs, being carried elsewhere, the 2,3-biphosphohemoglobin, also known as 2,3-BPG, is released, and in doing so is oxygen. So the next thing, this is kind of a a kind of quick equation here of how CO2 can affect the pH, and as we saw kind of in this model, we see that pH does directly affect the affinity of oxygen. So this is actually a quite kind of useful equation, actually, especially within healthcare, because there are actually a number of diseases and conditions where actually this kind of comes into effect. And as you see here, this is CO2 and H2O, carbonic anhydrase kind of helps kind of determine which way this equation goes. And then we have hydrogen ion, which we know is acidic, and then bicarb. And so, for example, if someone has diabetic ketoacidosis, if you've ever heard that term before, basically it's a term where someone's blood sugar becomes so high and they lack the necessary insulin to use that their body then begins to use fat and muscle tissue as an energy source. And when this occurs, acids are released. So our body tries its best to maintain homeostasis. So its idea of actually reducing, let me rephrase that. Its idea of increasing our pH or reducing acid actually is to shift over. And actually what you will see someone, especially with diabetic ketoacidosis, or also known as DKA, set in, is actually you'll see them breathe quickly. And what they're trying to do is they're increasing their CO2, and by doing that, if they keep breathing that off over and over and over, it's our body's kind of lame attempt to increase the pH to combat the hydrogen ions that are in the body. Of course, these patients need quite a bit of help in kind of reestablishing the homeostasis. There's actually quite a bit of fluid shifts that occur with this, and insulin needs to be given, and it's actually can be life-threatening if it's not caught early. Actually, it's, as I'm saying this, I completed an ER shift where I had a patient, or assisted with a patient in DKA, and their pH was 6.99, which is a great kind of far cry from the normal, 7.35 to 7.45. So this is kind of a quick kind of wrap up here of things that can affect oxygen affinity, and factors that can decrease oxygen affinity.